Good afternoon. My name is Alison McMillan. I'm the Commonwealth Chief Nursing and Midwifery Officer, and over a number of weeks now you've seen a range of my colleagues providing updates this time of the day on where we are in Australia in relation to this pandemic. Today it's my turn. So first of all, let me again congratulate all Australians on the terrific job everyone is doing in containing this pandemic. Everyone's playing their part, and whilst we're seeing now this flattening of the curve, as we've talked about, I'm here to remind everyone of the importance that we continue that over the coming weeks. As of right now, we know that there are a total of 6,606 confirmed cases in Australia, and sadly with that, 70 deaths. And I acknowledge that every death is very sad for the family and friends of those out there who have experienced this situation, and our hearts go out to all of them. Also, we can tell you today that now more than 420,000 tests have been done in Australia, and as you've heard possibly from the Prime Minister this morning, the Health Minister this morning, we are leading the way in testing, and of that we should be very proud of all of the work that's going out there today in promoting and encouraging that testing. Today also we've heard around the increase in the supply and delivery of personal protective equipment into Australia. That goes to protect and support our frontline healthcare workers as they go about their daily business. This is a critical part of that safeguard we have in our hospitals, in our aged care facilities, out there in primary healthcare, in GP practices and in pharmacies. And that supply will go out and be distributed in coming days, and will give us that additional confidence and comfort as we move forward in the coming weeks around this pandemic and where it's going. In those satisfying and very encouraging numbers we're seeing around the slowing of the spread or the flattening of the curve, as we've heard, there are, however, a number of outbreaks that you will have heard of, particularly some are focusing on in northwestern Tasmania and in residential aged care in New South Wales. And one of the aspects of that has come to the attention, of course, is the association of these outbreaks with healthcare workers. Healthcare workers are at our front line, and we value all of our healthcare workers greatly. And some questions are asked in recent times around the actions of healthcare workers. And so I'm here as one of those healthcare workers to remind all of my colleagues of the importance of following those principles that we've outlined to the community and mean the same to us. If you are unwell, please do not go to work. It may be as minor as a scratchy throat. Please don't go to work. Seek guidance and help through the telephone lines, through your GP or through your employer about what you should do. And again, to healthcare workers, I remind you that you need to be vigilant like everybody else does to the requirements of social distancing, because that's how we're going to protect those most vulnerable in our community from this pandemic as we go forward. So that's the sort of message we're trying to encourage to our healthcare workers and to our colleagues out in the community. I'm happy to take questions if there are questions of me.
Ms McMillan, could you just give us a bit of a progress report on the Northwest Tasmanian outbreak, and how soon till, for example, the hospital might be able to open? And also, what's the capacity of these OSMAT swab teams? Say there was several different kind of Northwest Tasmanian outbreaks, how easy could we deal with a number of similar outbreaks?
So the approach we've taken in northwestern Tasmania is to deploy an Australian medical assistance team. That's a team of doctors, nurses, pharmacists, pathologists, a whole range of people who have gone there to provide the service that can no longer be done because all of the healthcare workers, or a majority of them in that area, have had to be isolated because of that outbreak. So OSMAT is a national deployable capability. It's led from the Northern Territory on behalf of the country, and has been used on a number of occasions in recent times to support Australians. AUSMAT has been around for quite a number of years, but it has only been since the bushfires of this year that we've actually seen it deployed in Australia. So AUSMAT can do almost anything it's asked. AUSMAT is, as I say, a collection of nurses, doctors, pharmacists, logisticians, whatever we need. We can respond to the requirements of the community. We saw AUSMAT in Howard Springs. We saw them supporting the people on the Artania in Western Australia. We saw them on the flights as they returned from Wuhan. So we should be very pleased that in Australia we have such a flexible and dependable response system across this country. There are more than 800 people registered as a part of AUSMAT on a database that we keep updated, and they are all trained, and a large number of them are ready right now if we need to call on them to support Australia in whatever way it might be needed.
Ms McMillan, on the Tasmanian outbreak again, there were 3 nursing homes that were visited by a sick healthcare worker, about 500 tests done, and the result was that only 1 person has tested positive. How confident can we be that that is the only case given the incubation period? Will those people potentially need retesting at a later date? And also on that, with regards to the health worker who didn't initially know that they had to explain they'd been to those nursing homes, is there any value in healthcare workers potentially keeping their own notes of where they're going, just in case they do come up with this situation and they're then asked to retrace their steps?
I'll start with the last question first, which is healthcare workers do have a responsibility to tell their employers where they're working. So if you're a casual worker or someone who works as a part of a bank or an agency, you do have a responsibility to tell your employer you're doing that. Honesty and transparency is critical to protecting those most vulnerable. In relation to the testing, obviously the surveillance of that outbreak will go on through that public health unit, and we will watch and monitor that community for any other outbreaks. But there is a plan in place to contain that outbreak, but that is part of the normal day-to-day business of containment and monitoring of an outbreak such as this.
On the Australian figures nationally, do you have the information to hand as to how many people are in ICU or on ventilators of the people that have tested positive?
So the figures of this morning, there were 51 people in intensive care and 33 on ventilation across the country.
Can we also get an update on how soon IVF treatments could begin again? And also, I don't know if you have a comment for those women who are hoping that this will restart soon, and what it means for people who are worried about the amount of time they have to get these treatments.
Yeah. So IVF is very much front of mind for us at the moment. We are working through a plan for the return of further elective surgery in the coming weeks. The National Cabinet has asked the Australian Health Protection Principal Committee to provide them with that advice on Tuesday. And it is likely that we will see a staged increase in elective surgery now that we have the confidence that we have that supply, that critical supply of PPE behind us to support that. And certainly we were well aware of the importance of IVF to the community, and particularly those who are keen to continue with their program. So we will hope to be able to provide advice on that in the near future.
So can I just clarify that in terms of the priority list and elective surgery, is IVF near the top, and what other elective surgeries might be first to be able to be conducted again?
I'm going to wait until we get the advice from the Australian Health Protection Principal Committee, of which I'm a member, because I think it's the collective view, the advice to National Cabinet. That's how our decision making has been working, but certainly we are well aware of the importance of IVF as a part of that strategy.
Just following up on the PPE aspect of things, we know there's many more masks now in circulation, but what other PPE is still potentially in a state of shortage?
We still are really being very cautious with the use of all aspects of our PPE. So in a COVID-19 response, as you'll have seen visually, there's the goggles, gowns, gloves and masks. So all of those are important parts of our stockpile, and those are things that we continue to pursue. But we know that masks were very, very much a critical supply point that we needed to secure, and we've been able to do that as a country through some great work out there by the purchasers.
Ms. McMillan, has China been transparent enough when it comes to its coronavirus numbers, and does there need to be an independent global review as flagged by the Foreign Minister?
I think we heard the Foreign Minister this morning certainly express her view around the fact that we need to explore and understand this outbreak and how it came about and how the spread occurred. So I certainly heard the Foreign Minister say that this morning. I leave it to her to comment on Chinese transparency, because that's her position rather than mine. But I do think that we're hearing a keenness to certainly understand, so that we can learn from this, and should unfortunately ever happen again, we'll be even more prepared than we were this time.
With the cluster outbreaks that we have seen in Australia so far, where they've hit aged care homes, there's been rapid spreading of the virus. Does that mean that as we look to easing some of the restrictions, that things like visits to aged care homes are probably a fair way off, given how rapidly it is spreading among older Australians?
Yes, as we move forward, certainly our considerations in the next 4 weeks will be about where we can reintroduce things into the community that will have a very low impact on transmission. And part of our tactics will be that we've got very close monitoring, and if any outbreaks occur, we can tackle them quickly and address them quickly. So yes, definitely, in considering where we might make changes, protecting the vulnerable is certainly a major priority for us. And whilst we understand that the limitation of visitors into aged care is very difficult for some, particularly where there are elderly loved ones, it is important in protecting them from this virus, and we will need to see that continue.
Is there a risk of impatience in the community as we continue to see a flattening of the curve? The Health Minister was saying we've had a week with downward trends, people potentially getting impatient with the return to normal life.
I think that it would be very unusual if we didn't see some impatience, and that's why we are imploring the community to please stay on track. This is our time now to sustain this. We know, and we will continue to see outbreaks as we have. It gives us the capacity to get to those quickly, to deal with them quickly, but not see it overwhelm the system. And so, again, on behalf of all healthcare workers, but also all of Australians, we are asking you to stay on track. It's a long road here, and we've all heard those words on a number of occasions, and that's what we're asking everyone to do. Stay on track, stay home, stay safe.
What's your response to MPs like Barnaby Joyce, who say they will not download a forthcoming contact tracing app because they're scared of their privacy being kind of sent to the federal government?
So the mobile app that's been talked about is purely voluntary. We've heard that very clearly, that it is something you can choose to download the app and use it. And so there is a freedom of choice. And if ministers or MPs choose not to do that, that's absolutely their right. But what it will do is help us with another tool to tackle this outbreak and this pandemic, and particularly in being able to manage quickly any small outbreaks we might see. So it's to the advantages of us all. If either I were infected, I could quickly let other people know had been in my proximity, or I would get to know if somebody else was infected and I had been close to them. So it's a two-way street here, and it's to all of our advantage in the long run. But it is voluntary.
And just given the role that health professionals are playing here, and there have been some issues with people recalling everything that they've been involved in, is there any case where perhaps health professionals needing to download this app as opposed to it being voluntary, that health professionals might have more of a pressure on them to be able to monitor their movements?
Yeah, I'm pretty confident that we can say we're not going to put pressure on anyone to do this. It will be voluntary. There is a duty of care for all health professionals, that we do everything we can to protect those that we care for. And this is certainly one of those tools, but again, I certainly would not see anywhere that we would compel them to do that, but we would strongly encourage health professionals as a part of our community to do this if they choose to do so. Thank you very much.
Thank you.